Hi, this is It's Going to Be Okay with Dr. Roseann, and I am Dr. Roseann. And if you are new to me, make sure you join our Facebook group by heading over to www.drroseann.com/group. That's where we have an awesome tribe of parents just like you and me who really want actionable tips and tools that are safe and natural and aren't going to hurt your child's brain. And that's what we do every day in there. So jump into the conversation and find ways to help your child, you, and your entire family. So we're talking about ADHD and anxiety. They are like salt and pepper, just want to say. And I don't mean it in a good way, but anxiety and ADHD really honestly go hand in hand. I almost never have a child with ADHD who isn't anxious because, drum roll please, it's because they're always being corrected. I mean, if you're always being corrected and told, stop this, don't do this, don't touch your, did you get your homework, whatever, who wouldn't be anxious? So let's talk about it because sometimes kids with anxiety are mislabeled as ADHD and vice versa. And sometimes they co-occur. As I said, most of the time they do co-occur. But I also just want to have an important reminder. If you haven't listened to is it ADHD or something else? There are a lot of things that can impact a person's attention, and it doesn't have to be ADHD. All the time in our brain behavior reset program, we work with people all over the world in person and virtually. When we do a brain map and a strategy session, or if you're fully remote, we do what's called a brain check. We get to the bottom of it and we figure it out. We use quantitative data, and guess what? You get this girl's 3 decades of experience. So, somebody was like, hey, I can do neurofeedback locally. Why would I come to you? Well, good luck with that. So, you are paying for expertise and you really want to know what's going on. That's what I do every day. And I love it. If anybody's ever had a strategy session with me, it's like a reading of the tea leaves. And the important part of that is it gets kids the right help. Every week it happens. I mean, most people don't have accurate diagnosis, and they absolutely never have the full pieces of the puzzle. And every little piece makes a difference. So let's talk about anxiety, right? What does anxiety look like? You always hear me talk about dysregulated kids, and there's internalizers and externalizers. And internalizers, right, anxious kids can be an internalizer or an externalizer. So an internalizer is just what you would think about most anxious kids. There's worry in the inside, fearful thoughts dictate your actions or inaction. You avoid things, you need reassurance. There's a lot of stuff that goes on, right? And typically everybody who has anxiety has somatic symptoms. They're going to have belly aches or headaches. There's going to be something, chronic pain. And then on the externalizer side, you might have an anxious kid punching holes in the wall and telling you to F off. That can also be anxiety. And there can be kids that just quick flash dysregulate, and maybe they don't have inappropriate words with it, but that's what anxiety looks like in the real world. There is a persistent worry about something, and clinical anxiety has to be there for at least 6 months. And it can be related to a situational stressor, as I always talk about with my dysregulated kids that we see here every day in our brain behavior reset program. From all over. I'm getting every continent, peeps. Is that they are dysregulated due to compound stressors. So everyday stressors build up in the system. You don't have to have a little T or a big T, right? A little trauma or a big trauma for that to actually happen. So when we talked about anxiety, let's talk about ADHD. So you have to have it's got to show up before age 12. So if you just develop ADHD in the pandemic with no clinical history, and it doesn't mean a diagnosis, the behaviors are there and you could have been really functional. You have to have clinical signs before age 12. What does that mean? Inattentiveness, right? So, you are unfocused, distracted, you're having a hard time, your kid says, wah. The teacher says they're bright, but they're staring out the window all the time. And then you have to have hyper impulsivity behaviors. So those are kids that, are on that really hyper side. They're moving around, they're touching people, they won't get their hand off their sister, that. But also kids that struggle with transitioning, that is a lot to do with impulse control and regulation, switching between tasks, completing tasks, starting tasks. That's the world of ADHD. And when I think of ADHD, I really often think of like bright, capable kids that are distracted by their own inner thoughts or in their environment. And really, ultimately, kids with ADHD can hyper focus on preferred areas of interest because their brain can lock in, right? And when it's boring, forget about it. When you don't have an ADD brain, you can push yourself through boring things. With ADHD brain, it's, just can't stay locked down to a task. So how are anxiety and ADHD, how do they look the same? Like, what's the crossover? And I think for me, one of the first things I think about with both ADHD kids and anxious kids is avoidant and low motivation behaviors. These are two things that I hear a lot. So avoidant behaviors are, kids who are anxious avoid things that make them anxious. Kids with ADHD, different sources, but on the outside, this is what you're seeing. But kids with ADHD, they're avoiding things because it's hard or the brain isn't stimulated. So you're seeing that. And then motivation, again, I hear that word a lot. So the kids are disinterested in things. Avoidance may be behind it. And in case of ADHD, lack of interest, right? Because they're like, oh gosh, I'd rather do anything but that one thing, whatever that is. And it's so unique. These are unique to each person. However, anxious people are going to really avoid things that cause distress for them. And that thing that causes distress might be unique to them, right? My son's going to be doing, algebra. And I'm like, oh my God, stressed me out even talking about it, but somebody else, they might love it. Chris Hodge loves it. Papa Hodge, So some of the other things you might see, there might be a fear of socialization in both anxious individuals and kids for the ADHD. Different reasons why. And somebody with ADHD might not have been successful, and so they avoid it. And somebody with anxiety may or may not have been successful, but are afraid to do it because of fear of success. Ooh, I hope that was an unlock it moment for you. Both individuals with anxiety and ADHD tend to avoid group dynamics. So you might have them avoiding clubs. You might have them avoiding sports. I constantly hear this a lot from parents. There's an uncomfortableness. They're already struggling within themselves. So that may be a problem. Both people with ADHD and anxiety have difficulty staying focused, right? So somebody with ADHD, parts of their brain, particularly executive functioning regions, are not able to sustain attention long enough to do tasks. Somebody with worry has worry thoughts, right? OCD is intrusive thoughts, but that occur more than an hour a day. But they're thinking about something else other than the task, and it's worry based. From the outside, I'm going to tell you, in a classroom, these kids can look identical. And with today's stressors compounding within the nervous system, anxiety is often missed. So this is why this is a big conversation. Plus, we already talked about this. Most kids with ADHD, because of the constant correction and difficulty with my next common characteristic, low self-esteem, you really start to see that these kids struggle with how they feel about themselves, and they avoid tasks. The focus is different for them. I mean, feeling good about yourself means you have no limits. Let me say that again. Feeling good about yourself means you have no limits. When you are super competent and you do not feel good about yourself, you limit yourself. Loving yourself and having those good feelings, self-confidence, is critical for life success. We don't want to dive into the emotions. Like, a lot of my ADHD people, their families come to me because they're not doing well in school, and they sort of disregard some of the other things because we're so hung up on the grades are the benchmark of mental health. Listen to that episode if you haven't. And I don't mean that to shame you. Sometimes we just think it's going to all be okay if the grades are there, but it's the developing of the core. And that is a definite crossover symptom. They feel bad that, the anxious person feels bad that they're worried, and the kid with ADHD feels bad that they're unfocused. Difficulty completing tasks can really be an issue for both an ADD individual and somebody with anxiety. When anxiety is low level and if functional enough, it often helps them complete tasks. But once you reach your tipping point in your crisis, and people with anxiety, depression, OCD, often we don't know that this internal rumbling is going on. There might be signs and symptoms in terms of physical signs that you might not be making a connection, particularly for my little smarty pants kiddos and teenagers and college kids. But usually it gets to a crisis level and not completing tasks. I remember years ago, I had a young woman I was working with, and they brought her to me, and she went to college. She had known anxiety. The parents were like, she's a good student, she'll be fine. I didn't know this and didn't know her until after. Well, she went to college. She never left her room. And because of the way college is, they actually didn't even know until it was like Thanksgiving. And I think that the girl let the cat out of the bag. So, that's how serious it can be. And, luckily she came to us and worked within our brain behavior reset program. She didn't go back to school right then. And in fact, she took the whole rest of the year off and decided to really focus on her mental health because, as you heard me say, it was something she had been dealing with kind of in a Band-Aid way because the grades were good, but she couldn't manage without having scaffolding. So we reset her brain with neurofeedback. She did a lot of counseling, a lot of somatic work, and she was able to get better. So it was pretty incredible, and I'm really grateful that she came to us because she went on to leave a totally normal and functional life. So how are anxiety and ADHD different? Well, obviously, the source of the difficulties are completely different, right? So it could be the brain functioning is different, how the brain looks on a brain map is different, the patterning, somebody with ADHD, right? And so a lot of times people come to me and they want to know, right? I want to know what is actually going on. That's what happened to me this week. Somebody came to me and they were like, I want to know what's going on, have a ton of just bizarre diagnoses, right? So my little thinking cap goes on, and this is where all this, 3 decades of clinical experience, over 10,000 brain maps, all the diagnoses this young man had, and he had a shut down life, were all wrong, like 100% wrong. But anxiety was always there for sure. And they did a lot of kind of band-aiding things in order to help him. And attention problems were waxing and waning throughout that time. But in that brain map, you're literally able to say, well, this is the problem. It really was anxiety and not ADD, even though they had believed that it was ADHD his whole life. So it's really helpful to understand what those sources are, but they do look different in the brain. And with a QEEG, you're able to just see it. And not everybody can interpret brain maps. If you heard me talk, less than 2% of practitioners interpret their own brain maps. And I'm one of those nerdy ladies. Early onset. So, they are different because with ADHD, you're going to always have an onset before age 12, right? Even if it's not formally diagnosed, you go back, you connect the dots, it makes sense. But with anxiety, it can show up at any time. Now, anxiety, the average age of onset is age 6. So that is shocking, but very accurate. So the first signs will show up. The physical symptoms of both of these clinical issues can look different, right? So if the ADHD child is starting to show anxiety, obviously you're going to see similar kinds of things: belly aches, headaches, pain. That is very common in anxiety. Whenever I meet anybody of any age who has anxiety, I say, put your hand on your place of your body that you feel the anxiety the most. And, a lot of times I get it on the chest, the head, I've gotten it on the back of the knees. Like, it's so fascinating where it shows up for people. But kids with ADHD, the physical sides, right? If you're impulsive, you're going to have a lot of injuries, a lot of sensory, a lot of pushing, a lot of touching. The physical parts of it are going to look different. You're going to look for a different pattern. And really, ultimately, in the end, if you are unsure if your child has both anxiety or ADHD, they probably in reality have both. But many kids, just like the example I had, this is somebody that really was very anxious and it got misdiagnosed as ADHD because of the level of not being able to focus. And also, a lot of my anxious people could have dyslexia and learning problems, and they get missed all the time. So, look at what the sources are. My top takeaways are dig in, at whether you want to come and work with us in our one-to-one program, but you really have to decide, what is it? How do I get to the bottom of it? And I really am a fan of QEG. You want to do lab work, you want to check to what it is, but you can't get the right help if you don't have the right path. And if you think it's something else and that treatment, right? And I also caution you very strongly, a lot of my kids get misdiagnosed with ADHD that have anxiety. They get put on ADHD medication. And oh my gosh, it can be a nightmare. The level of agitation. I've had kids have psychotic breaks. I've had all kinds of things. These medications are dangerous. Please listen to those episodes, read the blogs. No shaming and blaming, education. But if you are unsure whether your child has anxiety or ADHD, get to the bottom of it.